In the first chapter, we started defining terms and we're going to go on with that. So we're still in chapter 1, and we talked about kinematics as being the movement of a body. We're going to expand that now, or drill down a little bit, into osteokinematics. So osteokinematics is the movement of bones. Osteo means bone. So it's the movement of bones without regard to the force that's moving them. So we're not there yet to talk about muscles and gravity and what's moving, but right now we're going to talk about the movement of bones. And so a lot of the terminology we use for movement has to do with the bones moving in relationship to one another. So we have to first define our playing field, basically. So our learning objectives, we're going to use anatomical position as a baseline to define the descriptive terminology used to describe the location of a structure and the relationship between structures. So we're going to practice that too. And then one of the first pages in your lab manual have to do with this. So if you want to pull out the lab manual and start working through some of those, that's a great thing to do. We need to be able to describe the planes and axes for common joint motions based on anatomical position. And we need to be able to define open and closed chain activities and give examples of each. So these learning objectives are sort of tying everything together, which is why I picked this graphic. So the planes of motion. So this guy, I call this figure plane man, plane guy. And it has the cardinal planes described on this person's body. So this figure is standing in an anatomical position. He's got his forearms supinated, the palms are forward, standing on both feet, standing straight up. So the sagittal plane is the left-right division. It's the imaginary plane that divides the body into left and right. So if you take a piece of paper and have it aimed sort of right towards your nose, that's your sagittal plane. It's dividing the body into right and left halves. The frontal plane divides the body into front and back halves. So our plane is coming in from the side. That's where the background, the plane fades into the background. It's dividing us into front and back, anterior, front, and posterior back. The horizontal or transverse plane is the top-bottom division. So the cardinal planes intersect, those three cardinal planes intersect at our center of gravity, which is about an inch below your umbilicus, or about the S2 level in your spine, the second sacral segment. Everybody has the same center of gravity. We all have different other proportions and everything, but that's our center of gravity. In anatomical position, the cardinal planes are all intersecting at that point. The degrees of freedom are the number of planes of motion that a joint allows. So a classic example of 1 degree of freedom is the elbow. You can basically 1 degree of freedom. It moves in the sagittal plane, flexion and extension. And so it has 1 degree of freedom. The shoulder, on the other hand, moves in the sagittal plane, moves in the frontal plane, moves in the horizontal or transverse plane. So the shoulder has at least 3 degrees of movement, as does the hip. So we'll define all the joints and what degrees of movement they have in the joint chapter. But that's what we mean by degrees of freedom. It's how many planes can that joint move in. And some of our joints have a lot and some have just one. So, and different types of joints will have different types of movement. And we'll talk about them all. So our axes of rotation, so when we have a plane and we're rotating through the plane, so say our elbow is flexing and extending, it's moving in the sagittal plane, but it's rotating around a medial lateral axis. So we can take a pencil, a piece of paper, and a pencil or a knitting needle like I have, And I'm going to put my knitting needle right through the middle of the paper. And so now I have an axis intersecting my plane. So if things are moving in the sagittal plane, they're moving along the medial lateral axis. If things are moving in the frontal plane, they are moving along the anterior posterior axis. If things are moving along in the vertical or longitudinal plane, rotational, or if they're moving in the transverse plane or the horizontal plane, it's a vertical or longitudinal axis. So take a piece of paper, poke a pen or pencil or knitting needle through it, and practice your planes and axes. So if you're in the sagittal plane, it's the medial lateral axis, frontal plane, anterior posterior axis, horizontal plane, and vertical or longitudinal axis. So a piece of paper really elucidates that quite well. So in the our joint in our body is usually the axis of rotation. That's the point about which the joint motion occurs. So the axis of rotation is always perpendicular to the plane of motion. So with our elbow flexion extension, it's in the sagittal plane and the medial lateral axis. So you can think about, you can take your pencil or your knitting needle and put it through your joint and say, which direction does it go? Does it go anterior, posterior? Does it go medial lateral? Does it go vertical or longitudinal? So those axes are perpendicular to the plane. And we're going to practice this a lot in lab, and hopefully it makes sense to you. So the rotational movements have different degrees of freedom. So these are our sort of main osteokinematic movements. Flexion and extension tends to happen in the sagittal plane. Dorsiflexion and plantar flexion are the special names for flexion and extension of the ankle, and that happens in the sagittal plane. Forward and backward bending, trunk flexion and trunk extension happen in the sagittal plane. In the frontal plane, you get ab and adduction, that's going out to the side and back in. Lateral flexion, which is also known as side bending. Ulnar and radial deviation, and inversion and eversion of the foot. In the horizontal plane, you get internal rotation and external rotation, also known as medial and lateral rotation, and axial rotation, so rotating along your center axis. So when we're pivoting our head, turning from side to side, that's axial rotation. When we're turning our trunk, that's axial rotation. So ulnar and radial deviation are really ab and adduction of the wrist. They're just special names for that. So when we go through each one of the joints, we will revisit the special names for the different movements of the joints. So there are specific osteokinematic definitions for all of those different movements that we just did a summary of. So flexion happens in the sagittal plane, and it's the motion of one bone approaching the flexor surface of another. Extension is the approximation of extensor surfaces of two bones. So when you look at the arm, when you flex your elbow, the flexor surface of the forearm moves against the flexor surface of the upper arm. That's flexion. When you extend, the extensor surfaces are getting close to each other. So approximation means getting closer to each other. Traction means getting farther from each other when it comes to joints and bones. Abduction is frontal plane movement away from the midline. So think of a jumping jack. And adduction is frontal plane movement toward the midline. Okay, and practice these all in your body so you get it not just in your brain, but in your body. And for every exam, you can have a cheat sheet. It's your body. You can take that with you to every exam. In fact, I'd recommend it. So it's pretty hard to take an exam without your body. So when we talk about rotation movements, the bony segment is sitting on its longitudinal axis of rotation. So with internal or medial rotation, the anterior bone surface rotates toward the midline. So when you internally rotate your shoulder, which is the letter B on the picture on the bottom there, the anterior surface of the humerus is rotating toward the midline. When you externally rotate, the anterior bone surface rotates away from the midline. Circumduction is a circular motion through two planes, usually the sagittal and frontal plane. So you have to have at least 2 degrees of freedom to do circumduction because you need to have sagittal plane motion and frontal plane motion. So you can't do circumduction in your elbow because you only have 1 degree of freedom in the elbow. So you have to have at least 2 degrees of freedom, but in your wrist, certainly you can circumduct. So you're combining flexion, extension, and adduction to get that circumduction. Protraction and retraction happen really only in the mandible and in the scapulae. So protraction is translation of the bone away from the midline in a plane parallel to the ground. So if you move your lower jaw forward, that's protraction. If you pull it back, that's retraction. If you move your scapulae forward anteriorly or away from the midline, that's protraction. If you move your scapulae together towards the midline, that's retraction. So they're moving parallel to the ground. They're not going up or down or in or out or anything like that. They're moving parallel to the ground, away from the midline or towards the midline. And really, scapular protraction and retraction and mandibular protraction and retraction are movements that we do frequently in physical therapy. So we do mandibular retraction when we are working on posture and cervical stabilization. And we do protraction and retraction when we're working on scapular stabilization. So very important concepts in physical therapy. Horizontal adduction and abduction is something that only the shoulder does. So it's shoulder motions in the transverse plane. So usually with horizontal AB and adduction, you can think of it as like the guy in the picture doing the bench curls, where your hands are coming from 90 degrees out to the side into the middle. That's horizontal adduction. Out to the side, that's horizontal abduction. So horizontal adduction, the hands come together. Horizontal abduction, the hands move away from the midline. So only the shoulder does horizontal ab and adduction, and it's in that particular plane. Pronation and supination only happen at the forearm. So pronation turns the palm posteriorly, and supination turns the palm anteriorly. So with supination, when your elbow is bent, it turns the palm up. And the mnemonic that a lot of people will use is you're holding a bowl of soup for supination, and then pronation is the opposite. We do talk about supination and pronation of the arch in the foot, and we'll talk about that more in the foot chapter. But that is not just a single joint movement, it's the movement of multiple joints. And so we'll put that aside for now, but pure pronation and supination only happen in the forearm. So when we start to get to the hands and feet, we have some special names for flexion, extension, and ab and adduction. So radial deviation is lateral hand movement towards the radius, so towards the thumb side of the hand. And when we say lateral, we're in anatomic position. So when you move towards the thumb side, you radially deviate or you abduct the wrists. Ulnar deviation is medial hand movement toward the ulna or toward the pinky side of the hand. So once you get out of anatomical position, it starts to get funny. So anatomical position is always our reference point. For the ankle, Dorsiflexion is sagittal plane ankle motion, bringing the foot upwards, and the top of the foot is called the dorsal surface or the dorsum of the foot. So dorsiflexion goes towards the dorsum of the foot. Plantar flexion is sagittal plane ankle motion, pushing the foot downward. The bottom of the foot is called the plantar surface of the foot, so plantar flexion goes towards the plantar surface of the foot. So some, like in layman's terms, a lot of times people think of dorsiflexion as flexing their foot and plantar flexion as pointing their foot, but we are going to refer to them by the proper anatomical terms of dorsiflexion and plantar flexion. That having been said, though, we do have to communicate with our patients, and so sometimes we have to use the layman's terms so they understand what we're asking them to do. But when we document it in the chart, we're going to use the correct anatomical terms. So inversion and eversion of the foot, it's frontal plane motions of the ankle foot complex. There are multiple joints involved, and we will talk a lot about this in the foot and ankle chapter. Inversion results in a medial facing sole of the foot or plantar surface of the foot, and eversion results in a lateral facing foot sole. So you can practice that on your own foot. So there are always two perspectives of movement at a joint. One of them is referred to as open chain motion, and one of them is referred to as closed chain motion. So the chain that we're talking about is the kinematic chain. So our kinematic chain is what hooks our joints to our body, basically. So an open chain movement is the movement of a distal segment of bone about a relatively fixed proximal segment. So if you're sitting in a chair, so in this diagram, you can think of letter A as the person is sitting in a chair. So the proximal part of your body trunk, is fixed on the chair by gravity. And if you extend your knee, the distal segment moves. The proximal segment does not. That is an open chain movement. A closed chain movement is a movement of the proximal segment of a bone around a relatively fixed distal segment. So same thing, you're sitting in a chair. If you stand up and extend your knee, that's a closed chain motion because the distal segment is fixed. The proximal segment moves, the distal segment does not. So think of some examples of different open chain and closed chain movements. And we'll talk about them in office hours. And so if basically you can have open chain or closed chain movements for your upper extremities or your lower extremities. Closed chain movements tend to be more functional movements, like sit to stand is a closed chain movement, or a internal knee extension is an open chain movement. For upper extremity, a push-up is a closed chain movement. Putting something up on a shelf is an open chain movement. So that's a functional activity, but it's still open chain. So think of examples of open chain and closed chain motions.